What is bronchial artery embolization and when is it needed?
Bronchial artery embolization means we are going to stop the blood to the diseased segment of a lung parenchyma, artery of lung, and then by injecting some of going to stop the bleeding.
Why is bronchial artery embolization better than the conventional modality of management for hemoptysis?
The conventional method of treating hemoptysis is usually a surgical method in which we cut out the entire lung parenchyma or entire lung segment, which is a very highly invasive and a very problematic situation for both doctor as well as the patient. So therefore we required a newer method of curing the hemoptysis or stopping the blood from the mouth. It is called as the bronchial artery embolization. It is a very safe, minimal invasive. Using a 2 mm hole in the body, we can cure any amount of blood coming out through coughing from the patients.
What is your clinical experience on the results that you have witnessed in your patients?
In our clinical experience, 100% of the patients have been effectively treated with bronchial artery embolization. There has been no complication related to bronchial artery embolization procedure. All the patients which have been admitted in ICU for the history of hemoptysis, they have been treated completely with the help of bronchial artery embolization. And also the data of the entire world and many of the random control trials, they say that for treatment of moderate to massive hemoptysis or hemoptysis which is not treated through medicine, patient can directly go for bronchial artery embolization and we can save the life of the patient. So the most common approach to treat bronchial artery is that we go through the femoral route. However, with the advancement through newer catheters and wires, now we can use the radial approach. In the radial approach, we go through your small artery in the hand, and just after the procedure, patient can be ambulatory, means he can walk and can do his basic and routine procedures and routine activities. However, in the traditional femoral route, there is a little risk of complication at the femoral site, and we need to advise patient for immobilization for up to 12 to 24 hours post-procedure.
What is the message you want to give to the general physicians about managing the patients in their OPD settings after the procedure has been done by an interventional radiologist?
And second thing is that if the patient has tumor and he has hemoptysis and we have done bronchial artery embolization, so oncologist should know that he should abide by the chemotherapeutic or immunotherapeutic management after the procedures. And third thing is that the patient should avoid any provocative agent which can cause hemoptysis. For example, smoking a cigarette or taking addiction drug which can lead to hemoptysis in a deceased patient.
When should the general practitioners advise the patient to undergo a bronchial artery embolization?
Yeah, I want to tell that the general practitioner should know that whenever the patient has moderate to severe grade of hemoptysis or patient is highly unstable or the patient has repeated episodes of hemoptysis beside medical management, then he should always ask or refer to intervention radiologist to perform bronchial artery embolization whenever required.